हाय फ्रेंड्स, वेलकम टू क्लासेस बाय लैब डॉक्टर। आज के क्लास में वी विल डिस्कस अबाउट द टेस्ट विच वी यूज टू फाइंड आउट ketones in the urine. So you all know whenever the ketone bodies are present in the blood, we call it as ketosis. And when the ketone bodies are present in the urine, we call it as ketonuria. So ketonuria happens whenever there is an excess levels of ketone bodies in the blood, and the kidney will try to get rid of these ketone bodies via the urine. We also call it as ketoaciduria or acetonuria. So whenever in cases of diabetics etc., whenever the patient is having high levels of ketones in the body, like in case of diabetic ketoacidosis, too many ketone bodies pile up in the blood and kidney will try to excrete it. Hence we get ketones in the urine. And remember, ketones are the substitute or it is an alternative source of fuel for the body. जब बॉडी को कार्बोहाइड्रेट नहीं मिलता है, वो स्टारवेशन से हो या तो फास्टिंग से हो या तो डायबिटिक में हो, जहाँ पे इंसुलिन कम हो या इंसुलिन सेंसिटिविटी कम हो जाता है, तो कार्बोहाइड्रेट यूटिलाइजेशन जब ठीक से नहीं होता है तो बॉडी ऑटोमेटिकली स्विच ओवर करता है एंड कीटोन्स को यूज करता है एंड फैट्स को यूज करता है एज एन अल्टरनेटिव मेटाबॉलिक सबस्ट्रेट. एंड उस फैट मेटाबॉलिज्म का ही एक मेटाबोलाइट है, दिस इज कीटोन. सो दिस इज एन अल्टरनेटिव फ्यूल टू द बॉडी. So I have told you that whenever there is a fat metabolism, अगर incomplete fat metabolism हो जाता है तो these are the intermediate products. These are the ketone bodies: acetone, acetoacetic acid and beta-hydroxybutyric acid. So why do we need to identify ketones in the urine? क्यों चाहिए हमको? Why do we have to identify these ketones in the urine? So ये ketones in the urine test में इसके लिए ये improvise हुआ, या the main objective was to help monitor people if they are at a risk of developing ketonuria. क्योंकि diabetic is a very common problem. India is a diabetic capital. तो इतने diabetic patients है हमारे country में. अगर हमको पता लगाना है कि कहीं ये patient diabetic ketoacidosis को तो नहीं जा रहा है, which is an emergency, patient उसके वजह से कोमा में जा सकता है, बहुत सारे complications हो सकते हैं. So this ketone test जो हम पता लगाते हैं यूरिन में, ये बहुत ही हेल्पफुल टेस्ट है. वी कैन फाइंड आउट वेदर द पेशेंट इज एट अ हायर रिस्क ऑफ गोइंग इनटू डायबिटिक कीटोएसिडोसिस. ये टाइप 1 डायबिटीज हो जो पेशेंट्स को इंसुलिन प्रोड्यूस ही नहीं कर सकते हैं, या तो टाइप 2 डायबिटीज हो जिनके पास इंसुलिन तो है बट वो रिस्पॉन्ड नहीं करते, सेंसिटिविटी इंसुलिन के लिए कम है. सो इफ अ पर्सन हैज टू मेनी कीटोन्स देन ही माइट बी एट अ रिस्क ऑफ डेवलपिंग डायबिटिक कीटोएसिडोसिस, which is a complication of diabetes which can lead to death or diabetic coma. So that is why this identifying ketones in the urine becomes important. So what are the tests for ketonuria? So we have Rotheras test, we have ferric chloride test, we have reagent strip test. So now let us see the Rotheras test. So what is the principle of this Rotheras test? So Rotheras test is whenever there are ketone bodies, could be acetone and acetoacetic acid, it will react with an alkaline solution of sodium nitroprusside forming a purple complex. So क्या होता है इस रोटेरास टेस्ट में? हम लोग एक 5 ml ऑफ यूरिन लेते हैं टेस्ट ट्यूब में, हम उसको सैचुरेट करते हैं अमोनियम सल्फेट से. वी विल सैचुरेट इट. देन व्हाट वी डू, वी ऐड अ फ्यू क्रिस्टल ऑफ सोडियम नाइट्रोप्रुसाइड एंड शेक इट वेल, एंड फ्रॉम द साइड्स ऑफ द ट्यूब वी ऐड अ liquor ammonia. So suppose if there is a purple colored ring which is present at the junction, that means ketone bodies are present. So this is a Rotheras test only, which is an alternative form in the form of a tablet. So this is called ACETEST tablet test. This also works on the principle of Rotheras test. There is something else called as ferric chloride test for ketone bodies. This we usually we don't do it because some of the drugs can give a similar reaction, so there can be a false positive reaction. But this is also one of the tests for ketone bodies. Next comes the reagent strip test. So reagent strip test is a very commonly done test in the laboratory. So what happens in this reagent strip test? See, ये जो reagent strips रहेंगे, this is just a modification of this nitroprusside test जो हमने Rotheras में देखा था. So these strips, ये जो urine के जो strips रहेंगे, they will be coated with alkaline sodium nitroprusside. They already will have the alkaline sodium nitroprusside, and when this strip is dipped in the urine, ये पर्पल कलर को चेंज हो जाएगा if ketone bodies are present in that urine. So you can see here, suppose if the ketone bodies are present in small amount, you get color like this. If it is moderate and if it is large, because it will react with the alkaline sodium nitroprusside. And ये बहुत ही sensitive test है, around 5 to 10 milligram of acetoacetate रहेगा, ketone रहेगा, तो भी इसको ये पता लगेगा. But इसका एक thing you have to remember in this test, if at all if you don't store the reagent strips properly, आपने उसको ठीक से you have not covered the lid, या तो आपने उसको बाहर ही expose करके रख दिया, तो it will give a wrong result. Exposure to moisture, reagent strips can give you false negative result. Patient का ketones रहने के बावजूद that can give you a negative result. को improperly इसको store किया है, then also you will get a wrong result. So you should be very careful in storing the reagent strips, and you should follow the manufacturer's instruction. So what is the normal range? Usually the ketone bodies are less than 5 milligram per deciliter. Agar if we are getting a value about 15 to 40 milligram per deciliter, then the amount of ketones would be around low to moderate. We grade it as low to moderate. Suppose if it is more than 80 milligram per deciliter, we call it as high, and if it is more than 160 milligram per deciliter, it is dangerously high. It is an emergency situation. The same thing, sometimes we tell it that ketone bodies traces बोलते हैं, sometimes we give it as small, we give it as moderate, we give it as large. So when we say traces, इसका मतलब उस sample of urine में the ketone level is less than 5 milligram per deciliter. When I say small, it is up to 15 milligram per deciliter. You will get a color like this, pinkish. Suppose if it is moderate, you might get around 40 to 80 milligram per deciliter, and if it is large, you will get something between 80 to 160 milligram per deciliter. So this is the urine strip you can see, and this is the ketone. So here it is negative when this yellowish color, what you can see, if it is small, this is slightly pinkish, then you can see the deep tinge of purplish when it is moderate and large. So these are the few of the tests which we use to identify ketones in the urine. इसमें से बहुत ही common test है ये reagent strip test. But many of the time the urine strips are not stored etc. properly. It is exposed. So उसके वजह से कभी-कभी you will get a wrong results also. So whenever you are interpreting urine ketones, you have to interpret along with the clinical condition of the patient. Patient क्या diabetic है, patient क्या starving है. If you are getting very high amount of ketones in the urine, it might become an emergency. You will have to inform the consultant, because in case of diabetic ketoacidosis, that can lead to acidosis, that can lead to electrolyte imbalance, that can lead to coma and even death. So एक emergency रहेगा. So when you get a very high level of ketones in the urine, that has to be immediately informed to the consultant. And what are the common causes of ketonuria? It could be type 1 diabetes or type 2 diabetes. It could be because of excessive consumption of alcohol, in pregnancy because of increased vomiting, hyperemesis gravidarum, because of certain medicines used like steroid medicine, or if you are starving, or if there is excessive vomiting, if there is any kind of an illness, infection, fever, if there is any emotional or a physical trauma, if the patient has suffered heart attack, if you have done an extreme exercise, if there is a dietary imbalance, you are on a specific kind of a diet like ketogenic diet wherein you have high fat, low carbohydrate, in all such condition, what happens, the ketone levels will rise in your blood and the kidney will try to excrete it out. That is all about the test to detect ketones in the urine. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.